everyone, and welcome again to the Doctor Show. I'm Dr. Zahra here, and today we're going to talk about something different. Sometimes people might say it's a little bit annoying. Today's topic is actually about snoring, when people snore at night. So I'm sure you've heard someone snore before, one of your family members, or maybe personally you. So today we're going to discover why does it happen, we're going to discover what do we do to actually make it stop, and what are the treatments for it. So before we actually start talking more about snoring, we have to know why does it happen from the beginning. Actually, the reasons for that are many reasons. One of them could be the shape of your mouth. If you have a small mouth inside, the shape of your nose. It could be if you're overweight, or it could be anything. But the mechanism of how we snore, it's because the air, when you have the air outside, the sound of your air with the relaxed tissues in your nostrils and your mouth, they actually make you make quite of a ugly sound. So all in all, snoring happens because of the relaxed tissues in all of your mouth. So before we start, how do I know that I snore at night? If you sleep with your partner, your wife or your husband, or if you have your siblings in the same room, or anyone who's sleeping around, I'm sure they might have told you if they heard you snore. But if they didn't, if you actually didn't know, you can actually do something very simple, is to record yourself at night. Just put a recording device, go to sleep, and do it multiple times, because some people, if they snore, they might have not snore every single night. So they could snore once every few days and so on. So record yourself and make sure to hear it, and you would discover if you snore or not. So let's say you actually do snore. We discover the reasons for that. Sometimes it could be you being too exhausted, that a blockage happens in your airway, or you have a runny nose. A lot of people who have the flu or the cold, they actually snore at night because of the passage of the airway, your end of the nose, and all of that. And even if your tonsils are actually inflamed and actually swollen, all of these reasons could cause you to have to snore. But when you have a runny nose, what do? You actually take the drugs. Anything that a drop on anything can open up the pathway or the passage of the air, and you will not snore anymore. So runny nose or stuffy nose is actually one of the very easy causes, easy to treat causes to your snoring. Other things could cause you snore as well. Like what? Sleeping on your back. Sleeping on your back is one of the main causes of snoring as well. Even if you snore, it makes you snore even louder. It makes it worse. So what do we do to actually avoid that? Sleeping on the side is very healthier when people actually snoring. So sleeping on the side can actually prevent you from doing so. And we have we always tell people as a little bit solution. What do? You could put a tennis ball in the back pocket of your pajamas to make you not comfortable to sleep on your back. You would always sleep on the side to avoid that. Some people have these little devices to vibrate and make them switch on a side. So sleeping on a side could actually make you snore less. The shape of your nose could be another reason for you to have snoring. What does that mean? Okay, before we actually start talking about the shape of your nose, you have to know that between the two nostrils, at the two nostrils are the two openings for the air. Of course, we know that. We inhale everything from them, and they go to the voice box, to the larynx, and then to the trachea, and then to your lungs. Between those two nostrils, there is something called a septum, or a wall. This wall, sometimes on the two sides, could actually grow different than each other. So it will cause a swelling on one side and not on the other side, something called a deviated septum. A deviated septum could cause you a little bit of a closure on one side of the nostril. So you might have a little bit of a closed airway on one side. So that is a huge reason for you to have a snore and deviated septum. Does it have a solution? Honestly, people who have deviated septum, sometimes they actually suffer a lot, because even when they get sick, it's a bit worse. Even when they get tired, it's a bit worse. So eventually, unfortunately, the only permanent treatment for it is to have surgery. And the shape of your mouth is something else to cause you snoring. Shape of your mouth. There is something called a soft palate. which is the upward of your mouth and the soft part of it. If it's actually small, and if the pieces, you know, when you open your mouth, as we can see here, when you open your mouth, there is a small of a tissue inside, a small hanging thing. Okay, it's called the uvula. The uvula and the soft palate together, if they're a bit small and the uvula is big, so the airway, it makes sense that the airway is much less, right? So when the airway is less, you snore much more. So having a small inner mouth and having a deviated septum, both of them anatomically could make you have snoring. What else? What are the causes? There is one certain disease, and actually this one is actually a serious one. This one is actually a bit of a dangerous one. It's called a sleep apnea. What is a whole sleep apnea mean? Sleep apnea means it's a disease that happens. People, when they sleep, like they're normally sleeping at their houses, and then suddenly when they're asleep, they have difficulty breathing. They feel like they cannot breathe anymore, and they wake up. Okay, it happens several times a day, several times when they're sleeping. It could happen only once. It could never happen once in a while. So sleep apnea, it needs to be actually treated. And if you know someone who has these symptoms, someone who actually gets interrupted in their sleep several times and it actually bothers them so much, it could actually make them feel that they're being choked while they're asleep, they have to go and see a doctor. They go and see the ear and nose and the throat doctor. And on a side note, guys, you have to always know, this is an extra thing you have to know on a side note, that every single disease has a certain doctor you go to. You cannot just go to any doctor. So if anything related to sleep apnea and ear and nose, there's a certain doctor called an ENT doctor, ear, nose, and throat doctor that you go to. Anyway, let's say we went to that doctor. This doctor, what does he do to the sleep apnea patient? He actually gives them a breathing machine. That's number one. Could have a breathing machine to help them breathe at night. It could make them have a sleep pattern that could help them. It could give him a little bit of drugs. So the treatment varies for sleep apnea, but it's a very serious disease and it needs serious treatment. So sleep apnea is very serious. If you know someone who might have these symptoms, please let them go and check a doctor. What else can actually makes us have snoring? Is it something I take as a medication that I take? It could be. I told you, when we started this episode, we said anything relaxation of those muscles around my mouth could cause you the snoring. So if I take any relaxing drug, anything, any depressant drug, all of that, for the muscles I mean, could cause me relaxation of the muscles of my mouth and could cause me to have snoring as well. So if you never snore and suddenly you started to snore, so obviously you don't have an anatomical reason, like why now do you have it? So it's obviously something you took, a medication you took. So that's why we need to track whatever we're taking and we need to actually see the source of whatever that I am having right now. And there is something else we have to always focus. If we check, if you're a mom and your child, you notice that your child snores, that's something not so okay. You have to actually go and look for a reason. If he has sinus problems, sinus is one of the spaces here to actually could have inflammation and could have problems. If he is overweight, you have to actually make sure that he loses weight. So if your child snores, you actually have to go and check with a doctor to see the reason and the cause of it so young. He could have deviated septum when he's young. It could have anything, any of the reasons we actually, he could have allergies. Allergies is one of the big reasons for snoring because allergies make things swell in your respiratory system or your breathing system. And if you're pregnant, guys, in pregnancy, everything, first of all, the lady gains weight. It's the baby's weight, it's everything else's weight. The mother has something called water retention. It means a lot of salt in her body. The lady actually, her whole body changes. So one of the changes that could happen is the swelling of this area, which makes her snore even more. Usually it's something very normal variant of a pregnant lady, but if it actually got worse, she should go and check her doctor immediately. So what do we do to actually treat snoring? First of all, we kept on saying overweight can cause snoring. So the actual makes sense solution is to lose weight, guys. In general, you don't even have to snore to lose weight. Losing weight and staying healthy is one of the basics to avoid all diseases like diabetes, like heart disease, like joint disease. You know, people who are overweight and obese, they eventually will have joint disease, they will have everything. So snoring, honestly, it's one of the minor problems for a person who has overweight. So all in all, we will have a whole episode about your healthy diet and what to avoid, what to eat, why junk food is bad. But until we reach that episode, for now, you should actually cut on your diet and you should make sure that you eat healthy, because if you lose weight, the snoring might totally stop and it actually could solve your problem. What are other things that you to do? A lot of medications that the doctor could give you, or maybe sleeping machines that could help you breathe. But all the treatments, it's depending on the reason. What's the reason? Some people, if they have a big uvula, which is the small muscle inside of you, inside of your mouth, could actually, a doctor could perform a surgery to take a little bit of it out and sometimes all of it out, okay, and sometimes make it a little bit smaller. If people have deviated septum, which is the swelling in the septum or the wall between their nostrils, the doctor actually have to perform a surgery to take it out. But all these extreme treatments only if a person actually necessarily needs it and is actually affecting his life. All in all, snoring is not something dangerous. Snoring does not affect us very much. It could just annoy people a little bit around us, but all in all, it's not that dangerous unless it is a sleep apnea, and I told you before, they have to go and check the doctor. So anyway, you don't need the surgery unless you actually necessarily need it. It's affecting your life badly and also. So is snoring that bad? Not really, it's not that dangerous. But if you have it out of the sudden, you go check your doctor. If you can't find a reason, please make sure to find a reason, and we always need to check for the doctor to know the reason. That's it for today. I am done with the snoring, and hopefully it was a little bit beneficial. If you guys have any questions about anything medical, please find us in the comment section of any of our social media and ask whatever you want. Thank you very much, and I'll see you next Tuesday. Goodbye.